The death of Robin Williams brought the conversation of suicide to the forefront. This week is Suicide Prevention Week. Now, here with more is Dr. Harold Schwartz from Hartford Hospital. Good morning to you. Thank you for coming in.
Good morning.
There's never a good time to talk about this, so this is the week to do it if we haven't done it before. And it's something we all have a responsibility to be aware of and be educated about, isn't it?
And that's what Suicide Prevention Week and Suicide Prevention Day is really is trying to do, trying to heighten our awareness of what really is one of the big killers in health, stands alongside cancer and heart disease as an important killer, and we've got to pay more attention to it.
And unfortunately, rates nationally have been going up, haven't they?
Rates have been going up, particularly for certain subgroups. So the baby boomers, for instance, are experiencing a 50% increase in suicide rates over the last year or two.
That's startling.
It is very startling. And at the same time, for younger people, older adolescents and young adults, suicide is the third largest killer, the third largest source of death for people in that age group.
Help us understand this, because everybody deals with conflict and problems. Some problems are so monumental that people go through, but yet they don't turn to suicide. For others, it's too much. What is the difference there? Why are some people pushed over the edge? What does it? There
is no single difference. Suicide's a very complex thing, and all individual cases vary, but individual resilience has a lot to do with it. The capacity to reach out and talk to people and share your problems. How often do we hear about somebody who gave no hint at all and then was dead the next day?
In fact, friends and family say they seemed never better. They seemed happy. They seemed connected and back. And then it's the next day.
That's one version of what happens. Another version is the individual who has severe depression or other mental illness, and we know about it, but we still don't do enough, or the person doesn't do enough to get help, or there isn't enough help available.
Why is it such a stigmatized aspect of mental illness?
Shame attaches to suicide like no other death, because we view it as a moral failure. Giving up a choice that somebody makes, as opposed to the end point of a very, very terrible mental illness, which is what it is.
Here in Connecticut, what is the most common form of suicide?
The most common form of suicide is by gun, and that is a really terrible thing, because when you try to kill yourself by gun, you almost always succeed.
There's good news, bad news when it comes to suicide rates here in Connecticut. The good news is our rates are low compared to the rest of the nation.
That's true, yes.
But the bad news is they're going up, aren't they?
Well, they're going up everywhere, you know, bit by bit, again, especially in the baby boomer generation. And, you know, people sometimes say that, well, the baby boomers have such high expectations of themselves that that's contributed to their rates, and certainly the recession hasn't helped. But we really ultimately don't know why one group is particularly more vulnerable than another, and why rates are rising.
We talked about the fact that often there are no symptoms, or you can misread symptoms. Are there some obvious signs that somebody might be taking this to the next level?
Well, I think if we start the discussion with a discussion about serious mental illness, and that's the place to start, and there certainly are signs of that. The majority of people suffer from depression, though people with other mental illnesses certainly kill themselves at high rates. So the signs and symptoms of depression are important. People who become withdrawn, who seem sad, tearful, difficulty sleeping, lack of pleasure and engagement in life. Every now and then, somebody who's on the path to suicide, though, in the last period of time may look better because they've decided on what their strategy to end their pain may be, and they feel a certain degree of relief from that. So we may see people who seem terribly distressed, and we may deal with people who don't seem terribly distressed and who really surprise us when they die by suicide.
So educating ourselves on all of this, all facets of this mental illness, and you know, this is something that we all have a responsibility to know as much about as possible. Dr. Schwartz, thanks so much for coming in this week.
Thank you for having me.
All right. Well, if you or someone you love needs immediate help, please call the Suicide Prevention Hotline. It's 211. All right, switching gears. Temps already in the high 70s as we look